Welcome, everyone. We let you in a little bit earlier while we're waiting for others to join. So we will start like 3 minutes past the hour. If you need to be ready before that, please take your time. And thank you for joining.
Right. Welcome quality of care. السؤال ده السؤال اللي جا مرة
Welcome everyone, colleagues. Let's give 3 more minutes for other colleagues to join in. And please unmute yourself throughout the session, and you can mute yourself throughout the session. You can unmute when we invite you to speak. Thank you so much.
Is that allowed? So allowed? Yes.
Good morning, good afternoon, good evening, colleagues and partners. My name is Nurian Zonom. I work with Save the Children. I co-chair the Global Health Cluster Quality Improvement Task Team with Dr. Iba Pasha from the Global Health Cluster. It is a great pleasure to welcome you today to the launch of the Mobile Clinic Quality of Care Toolkit for Humanitarian Settings. This toolkit now is available through Global Health Cluster website and also available through the Kaya platform. Few brief housekeeping points before we begin. During this webinar, we encourage you to ask questions using the questioning and answering function in the chat. And we will try to address them later in the session when we have a Q&A time. Interpretation will not be available during this launch event. However, we have similar events planned in Arabic, French, and Spanish. You can also register for that through the Global Health Cluster event page, and just Veronique included the link in the chat. And please feel free to share that link with your colleagues as well. So the recording of this session will be available later after this event through Global Health Cluster event webpage. So you can, if colleagues missed it, you can forward them the link so they can listen to it. In terms of today's agenda, we will begin with a short overview of why the Mobile Clinic Quality of Care Toolkit was developed and the gaps the toolkit tried to fill in. After that, then we will introduce the toolkit component, explain where to access them, how can you use it in the practice. So with that, it is my great pleasure to invite Dr. Iba Pasha, the Global Health Cluster Coordinator, to provide some background and set the scene for today's lunch. Dr. Iba, welcome.
Thank you so much, Narian. It's always a pleasure working with you. And welcome, colleagues. I'm going through the participant list. I know some of you, so for those who I know, hi, nice to see you again. And it's always wonderful to see everyone's commitment to advancing in their work. And for those of the people that I do not know, I hope the work that we have been doing with Save the Children and with Global Health Cluster partners and country level partners is useful for you. So always hold us to account. Right, so we're just talking about the mobile health clinics component. We know in humanitarian response, mobile clinics are absolutely essential. We operate and we start mobile clinics when populations don't actually have access to healthcare. Our role in humanitarian response is to provide that extra capacity to reach the last mile. So it's not just the very normal modality of healthcare, it's actually often the only access to healthcare and the only lifeline that populations have. And just to put it in context, with cluster partners, we support about 10,000 facilities, and actually 2,000 of those are mobile health clinics. So in the worst of situations, mobile clinics are absolutely vital. Yet even though we know this is so important, we don't actually have a uniform consensus on what is a good mobile clinic. What is quality? Is it safe, effective? Are we reaching the people that we're meant to? And so using the concepts around what is defined within health in general around quality of care that has been developed by WHO, the Global Health Cluster has endorsed that. So the main problems with mobile clinics is that actually there's been limited evidence previously on why we should establish clinics, how to make that decision, whether or not we're going to do it. And then again, to actually agree on what is a good mobile clinic, what is quality, and thereby how do we define it and monitor it. So recognizing this gap that clearly came from all the cluster partners out there, the Global Health Cluster as our job to support you. And thankfully, under Save the Children, who were able to take this on with the support of the former Bureau for Humanitarian Assistance from the US government, developed a work plan to prioritize a collective effort to collectively together define what this should really look like so we know what we are doing in humanitarian response. So this actually started with a huge amount of research, which is a multi-cluster, multi-country initiative. And it was from this research, which took over 2 years, we developed and piloted the mobile clinic quality of care toolkit, which we will be going through today. And what it does, it translates existing core commitments and principles that WHO and ministries of health are using it, and then tailored it for humanitarian response and for mobile clinics as a service delivery platform. So yes, moving on here. I just want to kind of ground us in why we are talking about quality of care, because we always think about access maybe as the thing that's most important, or actually maybe amongst you, you already know that's not the only thing that's important. Access is not the only thing that will help save lives. If care is really poorly delivered, if we do not do what we are doing well, that actually can cause harm. I say this often, that humanitarian health response has a great risk of actually creating harm instead of preventing harm. So quality of care is absolutely essential because access alone doesn't save lives. So within this, poor quality can not just mean bad care, unsafe care. It could also mean wastage of human resources, wastage of inputs that we are giving, making us inefficient, especially if we're not coordinated across the delivery platforms and with others. So expanding coverage also isn't the only thing this is needed. So this is why WHO and the Global Health Cluster have placed huge emphasis on quality of care. And we have other humanitarian response standards like SPHERE, the core humanitarian standards, which is all about quality. What we do has got to mean something. And so it's upon this that this toolkit was developed. So if we just go to the next slide. Great, these are some important figures for me to convince you that quality of care is really important, though of course you already know this. So I'm just going to look at two figures here. The first one, nearly 8 million deaths, about 8 million deaths are actually attributed to poor quality of care in the lower and low middle income countries. And actually, of all the mortality in those countries, 15% is due to poor quality of care. That's what we do. So again, that's quite a bit of harm. And actually 60% of deaths from these require healthcare are due to poor quality of care. Whereas the remaining is actually, so the minority of it is because they don't have access to healthcare. So actually the burden of responsibility is upon us to make sure we know what we are doing and do not create harm. So again, it's not about what services are available, but how we deliver it. We need to make it safe. We need to make sure we are consistent and that we ensure coordination. Otherwise, we're just undermining everything that we are trying to do. So this is what the toolkit is trying to do. So let's go to some key quality guidance that we all follow in frameworks. So everyone's heard of the core humanitarian standards. That's part of SPHERE as well, really defining our accountability and responsibility, not creating harm, but making sure that what we do actually tries and helps the people that we're trying to reach. During humanitarian crisis, we know that mobile clinics are often the only source of care. So actually, the Global Health Cluster has a position on quality of care in humanitarian settings, which is in line and in tandem with the WHO frameworks on quality of care in fragile, conflict, vulnerable settings. So we have been able to utilize these tools and translate it and make it relevant using the research that was done to support what we have to do in a mobile clinic. It's not a fixed facility. It's not always the same cadre of personnel. And given that there's been limited guidance previously, this helps us translate it into something operational. So let's go to the next slide, please. So I'm sure you are all aware of the 7 domains of quality of care. I'll just quickly read them out. People-centeredness has to mean something to the people, has to be safe, has to be efficient, has to be equitable, has to be on time, has to be integrated. It's a health system after all, and it has to do what it's meant to do and be effective. So the toolkit that we have doesn't replace any of these frameworks. It just helps us make partners and the clusters able to use those concepts and guidance and translate it into something practical that's real for mobile service delivery platforms. Why do we have to do it together? Because we're all accountable. We are all offering ourselves for humanitarian response, and we all, at the minimum, do not want to create harm, but we all want a collective understanding, a harmonized agreement, understanding to ensure that we deliver on what we want. So it ensures our accountability. So if we go to the next phase, slides, please. So just a quick background. It was a 3-phase approach. First of all, for 2 years, over 2 years actually, we actually did the research around this, and this involved multiple countries, multiple focus group discussions, key informed interviews, a lot of in-depth work that was actually published by Save the Children as well. And the clear outcome that came from this is that mobile clinics are actually really important and useful in early parts of the response, in a humanitarian response, but also in hard to reach areas. And it has to be flexible and adaptable in evolving contexts. So when things are very, very fluid, the context is very, very fluid, actually mobile clinics are able to address that. However, it's intermittent. It's not 24-hour, and sometimes it's not a daily. There's not a mobile clinic a daily available in an area. So it's intermittent services. It can be short operating hours, and it can be quite logistically heavy if you're having to establish a clinic every single day. And one of the biggest things which we always worry about in any humanitarian response for any service delivery platform is the continuity of care, not just to follow up in the same location, but also for referrals. What was also key from the findings is that there's no agreed definition around quality, exactly what we've talked about before. And there was no actual tool to help make you think, number one, how to start a clinic or if you should start it, and likewise, if and when you should exit it. And so from this research, actually 24 quality markers were identified, which are part of this toolkit that you will see. And it covers all the 7 domains that we cover in quality of care. Phase 2 of this whole process was developing the toolkit itself and piloting it, which we've done in multiple countries as well. And phase 3 right now is this dissemination phase where we are sharing it and supporting partners to really understand the toolkit and be able to use it for their own operational decision making, but also for clusters to be able to collectively discuss how and when mobile clinics should be established and the quality of care that's required for it. So it's important, it's data-driven. This toolkit is all based on evidence that comes from you and existing frameworks. It's practical, I think it's very practical, and hopefully you will too. It ensures a continuous quality improvement mechanisms and systems to be built either in your agency or across the clusters, and it's open source, available for everyone. And you'll find that it's a modular approach, which I will hand over back to Nurayan, who will take it further and explain to you.
Thank you so much, Dr. Iba. Okay, so quality of care in mobile clinics. Why quality of care in mobile clinics? I think Dr. Iba already provided very detailed background. Just one thing I want to iterate is the quality of care in the humanitarian settings guidelines documents Dr. Iba mentioned earlier, mostly tailored for fixed facilities. They are not specifically tailored for mobile clinics. So with that in practice, if you are delivering services with mobile clinic in the humanitarian settings, you left with the situation that how you interpret this guidance or like the benchmarks developed for the fixed facility to mobile clinic. That is like one challenge people need to face. The second one is the operational constraints of mobile clinic is not reflected in those available guidelines because they designed for fixed facility. As we all know, mobile clinic operates in under unique conditions. For example, it uses temporary infrastructure, and we have limited privacy available through when we deliver services through mobile clinic. And also we have limitations in the IPC facilities, WASH facilities, limited referral control, and we cannot also make sure the continuation of services available for people. And then, of course, the harsh working condition, also very challenging for the service providers as well. Without explicit adaptation, the standards may become very unrealistic because the standards are set for fixed facilities, and now we try to use it for mobile clinics. Also, the quality may be unintentionally compromised because your standards are set for fixed facility and you have a lot of challenges here with the mobile clinic. So you might be like your quality might be unintentionally compromised. So the toolkit we have developed translates the standards into operational realistic quality expectation for mobile clinic service delivery. So what factors influence quality of care in mobile clinic? So if you see this circle here, so the quality of care in mobile clinics influenced by 3 layers of factors. So the first one is the general factors. General factors such as, like clinical competency of service providers, adherence to the guidelines, patient safety, continuity of care, things like that is not specific to any modality of service delivery, but it should be done in any situation if you are doing health services or delivering health services. So it's not applicable for one specific condition. It should be applicable for every health service delivery modality in every context. So the second layer here is factors or characteristics of humanitarian settings. So when we are in the humanitarian situation, that brings this new set of characteristics. For example, damaged infrastructure due to the ongoing humanitarian situation, supply chain disruption, shortage of human resources, security constraints for the people who are accessing services or for the people who are providing services, and also like population displacement. Those factors already make quality delivery more complex. And then we come to the third circle or third layer is factors inherent to mobile clinic specifically, the mobile clinic as a service delivery modality. That could be like, the service packages you're using could be limited, or like maybe it cannot be delivered with the mobile clinic where you're operating your mobile clinics. And also what kind of services you can offer also limited by what can you transport with the one vehicle or two vehicles. And also the climate conditions directly affect medicine storage, privacy, patients, patients' comfort, travel and setup time for all that also impact how many hours of services you can offer in like one service delivery point. Also one mobile clinic rotating to different locations. So like that impacts the referral services, also the continuation of services. Those are not minor operational details, but they fundamentally shape how quality can be delivered through mobile clinics. So where the toolkit fits in now with all those, in factors influencing the quality of care. So the toolkit is mostly focused on this third layer. You can see there, the layer is highlighted in the red, the factors inherent to the mobile clinic modality. So with that, we're trying to, the operational reality of mobile clinic service delivery. And then also we are using the 24 markers, as Dr. Iba mentioned, under the 7 domains. So with that, we are trying to make sure when you use the mobile clinic for service delivery, you are doing quality services using the tools we have produced. Also, the toolkit cannot replace other clinical guidelines or the Ministry of Health or WHO technical guidelines on how you can deliver certain services and what are the benchmarks we need to use. For example, we do have IMNCI guidance, and it should be applied regardless where you treating children under 5. It can be in the hospital settings, it can be in mobile clinic settings. So you need to follow that. But the tools we have developed should be used together with those clinical guidelines. And how does the toolkit we have developed bridges the gap? The toolkit, at least we try to use the toolkit to bridge global standards and the field level, the challenges by defining what quality looks like in mobile clinic context. Also by providing measurable quality markers and supporting structured deployment to this decision to deploy mobile clinics, and then guiding responsible transition from mobile clinics and then exit strategy. So it recognizes a critical principle. Quality in mobile clinic is not identical to quality in a fixed facility. But the quality with providing through mobile clinics must be still, the services we're providing through mobile clinics must be safe, effective, and we are providing services in accountability manner. So this shift moves us from viewing mobile clinic as an emergency compromise to mobile clinic as accountable, quality assured service delivery platform. At least that's what we're trying to do with the tools we have developed. If participants want to, understand those circles better, as part of the toolkit, we do have a e-learning course called Quality of Care in Mobile Clinics. And I highly recommend you to go and take the course. It's a course and gives you more detailed information on each layers and how the quality of care in mobile clinics are reflected in the reality. And next slide, please. Okay, we talked about a lot for mobile clinics. How are we defining mobile clinics? So we have defined mobile clinic as a moving service delivery platform that is self-sufficient or standalone, but can operate from a fixed facility. And mobile clinic provide temporary, intermittent, preventative, and curative primary healthcare services by a multidisciplinary teams of trained health workers at multiple service delivery points during daylight hours in accordance with local guidance. So this is the sort of definition we used. Why we needed to have a definition? Because during the research Dr. Iba mentioned, we noticed that, the people define mobile clinics differently, and not having a unified definition is impacting what kind of services we offer through mobile clinic, but also what people expect from mobile clinics. So we have come up with this definition by using the findings from the research we have done with, and I know many of you have been part of it as a key informant, or we went to see how you deliver services through mobile clinics. And then we also use the evidence from the literature, available literature we have reviewed. And then also couple of consultations we organized with Global Health Cluster partners and the field practitioner. So after going through this process, we agreed that we will use this definition for mobile clinic. So why the definition matters now? This definition is not, again, as I said, we didn't come up with this just like that. We have gone through a strict process to define this. So this definition is used to shape the entire toolkit. And this definition helps us to clarify what level of services or what level of care is realistically feasible for mobile clinics, and what service package is appropriate, at what infrastructure can be expected, what staffing model is required, and what quality markers are realistic for mobile clinic and can be measured. For example, like, later when we go through the toolkit, you will see that we do have a list of recommended services you can deliver through mobile clinic safely. So that also developed by using this definition. So by clearly defining the mobile clinic, we are sort of like avoiding two risks. The first risk we are avoiding is overloading mobile clinic by, with unrealistic expectations. We are trying to ask them to do everything and anything, and we know it's not possible. But with this definition, we're trying to minimize that risk. So second one is understanding underserving communities by lowering standards unnecessarily. So this definition will help us to set the standards, so we are not underserving the communities we're supposed to serve. Also, the clear definition ensures that quality expectations are realistic, operational, context specific, yet still aligned with national and international standards. So defining the mobile clinic, the definition, having a clear definition, sort of like, it was essential to move us from mobile clinic as a generic accepted to from that to mobile clinic as a defined service delivery platform with accountable quality standards. So that's why the definition is important, and we need to remember that. With that, now we will come to how does the toolkit look like, where you can access it. So I'm inviting my colleague Willem Sols, who has been there with me from the day one, the conceptualization of the research to developing, piloting the toolkits. Welcome, Willem, over to you.
Thank you. So we've spoken about the problem, the research, and we clarified what defines a mobile clinic. So now let's introduce the tool kit. So it's a toolkit that starts from decision making. So do you want are you going for a mobile clinic or another type of intervention, up to designing your program, your mobile clinic program, to delivering, monitoring, and improving. It's using the 24 markers, as was said before. We have 5 tools in total, which are interlinked tools, but it can also be used separately, so independently. But together, they create your complete package, complete quality pathway for mobile clinic programming. So here is a quick overview of the different tools that we have. And I will, once after this, I will move to the Kaya platform, because I think I already saw in the chat there are people that are eager to learn more where to find these tools. So very quickly, briefly, this is your planning and decision-making tool that informs you, helps you to make an informed choice. Should you deploy a mobile clinic, yes or no? And then it gives you intervention options with recommendations. You have your list of services. So it's a minimum service package that we developed, quality of care guidance, which provides operational guidance from moment of proposal writing up to monitoring and improving your mobile clinic. And then we have our quality monitoring tool, which is a tool that helps you to track your performance in your mobile clinic using the 24 markers. and then also to that you have measurable data that you can actually use for quality improvement planning, where we have a improvement plan also for. So let's not waste more time on these slides, and I'll move to the Kaya platform. And I'm going to switch my screen so that I'm looking straight instead of in front of me on the side, because I have multiple screens. So give me 1 second. Yes. Yeah. So this is the Kaya platform. It's a platform where any organization can host learnings. So that can be e-learnings, and we have used it for our mobile clinic Toolkit. You can make a free account by just going to the Kaya platform homepage. It's a free account. You just leave a couple of details, and then you can start using the toolkit by using the link that has been provided in the chat, but also on the Global Health Cluster website, there is a specific place where you can access the toolkit. Once you open it, you have maybe a collapsed view or an expanded view. I like to expand it so that I can see all the tools. So here you have your 5 tools that I've shown before, with some supporting documents as well. On the left side is a navigation panel that is basically mirroring the tool chapters here. So it's up to you as a user how you want to navigate the toolkit. In your information section, you will find information around the tool, why the tool is there, for who the tool is useful, how you can benefit from it, also how long it will take you. We do not have a fixed duration for that because there are multiple tools. As I was saying, you select and pick what is appropriate to your situation. So there is no given time, and also we all go through these documents on our own pace. The only thing where we do provide advice and approximate for 1.5 hours for the e-learning module you will need to complete. It doesn't cost you anything. It's open source. Also, you can even tweak and contextualize some of the documents and tools that we have. It's really there for partners to use. And then there is no certificate for using the toolkit, but there is a certificate for completing the e-learning that you can get at the end of the e-learning. So let me go to the tools, the overview. You have an overview here where you get some information on why this toolkit is there and what it does for you. Earlier, Nurian mentioned the definition of mobile clinics. We have a couple of other definitions and terminology that we find you need to have at least. It's like a framework so that we all speak the same language when we are looking at mobile clinics. So it's a PDF where you can find the different definitions. You can go over it in your own time. Then we have also the 24 markers for people interested in the 24 markers. It's another background document that will give you all the markers per domain. So if I would go to people-centered care, you have 3 markers on the people-centered care. It provides you some influencing factors that influence this domain in the mobile clinic. And then also intervention options that you recommendations to enhance people-centered care in mobile clinics. This document is also part of the e-learning. So once you go in the e-learning, you are also able to download this document. If I go to the e-learning, here is the link to the e-learning. You can leave feedback, and here you can collect your certificate once you complete the e-learning. So let me open the e-learning for you. No, I don't want to resume. So this is the home screen. This is where the welcome screen where you begin. So you have 4 chapters in the e-learning. You have a mobile clinic here that starts at the welcome. It's just telling you what you will learn, how to navigate the e-learning, and where you can obtain your certificate. Then if you move to the first chapter, then there you learn about quality of care, which Nurian already showed you with the diagram. So first we start with general information around quality of care and why it is important, the domains, you learn about that. You learn about factors in humanitarian settings. And a lot of the learning goes through scenario-based learning. So we have, for this chapter, 2 scenarios where you will have to answer and, basically through exercises, learn more about quality of care. Then the mobile clinic is now chapter 2. It will now move to chapter 3. So that is the chapter where we discuss quality of care specific to mobile clinics, where all the tools, as we have mentioned before, are focused on. So what are mobile clinics? Of course, again, we need to understand what mobile clinics are. What are the limitations? We have talked about that also. Here you have this diagram, so it comes back for you to understand better, and the different markers. And wherever you see this, for example, you can download the document from there and use it to whatever you need it for. And then the mobile clinic finally arrives at the last destination, and that is a practical exercise. There are 3 scenarios where you basically use your learning from the 2 other chapters and you apply it in 3 different scenarios. Once you complete those scenarios, then you're ready to move and collect your certificate. So that's for the mobile clinic e-learning. It's really there. It's a good start for this toolkit. If you're less familiar with quality of care, it gives you a really good background on what it means and where quality of care lies in mobile clinics. Moving on to the first tool, that's the planning and decision-making tool. It has 5 items. It has a survey, Kobo-based, with a flowchart that is basically the mirror of the survey. We have a user guide that explains how to use the decision-making and planning tool, and video tutorials as well, and a master Kobo sheet. I want to give you a quick view of the video option explaining this tool, for example. Hope the sound is working.
Mobile clinics play a vital role in increasing access to care in humanitarian settings, particularly when fixed health services are unavailable or disrupted. But it's important to remember that they also come with limitations, such as challenges with continuity of care, staffing, and follow-up. Because of this, mobile clinics should be seen as a temporary and last resort solution, with planning for a transition to more permanent or semi-permanent services as soon as the situation allows. That's why it's so important to assess carefully when and how to use them. The mobile clinic planning and decision-making tool helps you do exactly that. It supports users to assess the availability, accessibility, and acceptability of primary healthcare services for crisis-affected populations. Based on what you input, the tool provides tailored recommendations, including whether a mobile clinic is the most suitable option, or if another intervention would be more appropriate. It also indicates what conditions need to be in place, and when a mobile clinic should be deployed or transitioned out. It's designed with key humanitarian principles in mind, ensuring that the response is people-centered, accountable, and inclusive of vulnerable groups. You can use the tool in 2 ways: to assess whether a new mobile clinic should be set up, or to review an existing one and see if it's still the best option. It also offers guidance on cost considerations and exit strategies, helping teams design efficient, effective, and sustainable interventions. So,
So as you can see, this is one of the videos. The video tutorials are 9 in total for the planning and decision making tool. This was just to give you an example of how they look like. Within the tools are 12 different languages also embedded, so you can change the language settings to 12 different types of languages. Also, subtitles are available, and we're working also on Arabic subtitles, I think it was. The list of services that we have, it's a minimum set of mobile clinic services that have been validated by a lot of different actors, global experts. There is a framework here that explains how the process was done with a methodology, and also all the contributors to this process have been acknowledged. And packages can be contextualized and are actually at the moment contextualized. Yemen, for example, is working at it at the moment. Which can be done here on the Speedy platform. It's normally done as a country level exercise by cluster and MOH. Then we have our quality of care guidance, which is currently in 3 different languages: English, Arabic, and French. I will open the English version. That's the language I'm most familiar with. We have 2 parts. So you have your first part is operationalizing markers of quality in mobile clinics, where it's broken down by domain. So it explains how the markers are working in that domain. And then next is it looks at practical guidance, which we then have clustered around how can you, for example, optimize quality of care for people-centered care in coordination and proposal and budgeting and pre-implementation and implementation, monitoring and evaluation. And then we have for each domain also annexes that you can access. These are annexes that were shared by different partners and which we have clustered per domain. So here's, for example, from IMC is a document, from IRC, Save the Children has documents, the WHO. You can just click on one and then it will open up the document. Another way to do it is if you go to here, practical guidance annexes. If you would like to have all the documents from people-centered care, for example, you can just download it here. And as you can see, they are in formats that are easily tweakable or convert. You can convert it to Word. Some are in Word, some are in Excel. So a lot of options there for you to contextualize. This document is interactive, so you have here on the side all access to move quickly to another part of the document. So I'm moving now to part 2, which is our quality assurance operational checklist. It's a checklist that is also broken down, structured around assessment, planning, preparation and implementation, monitoring and evaluation, and then exit and phase out. It uses a traffic light system, so critical tasks or recommendations that we have. So those are the must-dos, the recommended, so high impact and cost, context dependent. And then you have your extended tasks, which would be more flexible and based on what you have in terms of resources. Scrolling to exit phase out, for example, you will see also information about the need for exit and why that is needed, how to engage stakeholders, which type of stakeholders, etc. So a lot of information there. I suggest just have a look at it and play with and you get familiar with it. But it really provides you from decision making up to closure in guidance and how to do it as within the quality domains as best as possible. Looking at the time, I think I'm not sure I have time to cover the quality monitoring tool, but just very quickly. It's also a Kobo-based survey tool, so you have your Kobo in the background, and you have a guide that helps you to understand how to navigate the tool. It is in English, Arabic, and French. We have 6 video tutorials for this tool. We have a data compilation sheet because we are working with 5 sources of verification within this tool that can also be triangulated. So you have patient exit interviews, for example. You have community leadership interviews. We have random community member interviews. We have direct observation of a mobile clinic and mobile clinic team discussions. All the questions together, they cover all the domains. But yeah, one question can be asked to multiple sources of verification, which allows you for the triangulation option. Like if you have a question that you ask a patient as well as a community member and a team leader, mobile clinic team, you can see if there is discrepancy in their answers, and that gives you additional data besides the answer to the question. And this is also something we learned from the research is very useful. Both the decision-making tool and the monitoring tool have a master Kobo sheet. So that's for advanced users that can contextualize or tweak the mobile clinic tool. It's basically the back end of Kobo. And then lastly, there's the quality improvement template. That is an Excel sheet where the findings from the monitoring tool can be plugged in, and then you can develop your plan. Quickly showing it, and then I'm handing over for question and answer. So you have also broken down with your domains, your markers, what comes out of the tool, the action points, and it's basically a template that helps you to structure your improvement plan. That's it from my end. Handing back to, I think it's Nurian or.
Yes, thank you, Willem, for this very quick and brief overview of the tools. We understand that it might look very overwhelming when you first encounter it. So the toolkit has 5 different tools. So we have the planning and decision-making tool. We have the list of services you should deliver through mobile clinics. We have the quality monitoring tool. Can you go back to the previous slide, please? And we have the quality improvement template, and we have the quality of care guidance. My recommendation is you can go through them in your own time now. Now you know where they are, what can they do in the brief. So you need to go through them through the Kaya platform. Can you go to the next slide? So the link is available in next slide. And we are planning to organize some sort of drop-in sessions. Once you have time to go through it, and if you have questions, we will organize the drop-in sessions. The email will be sent out to the people who have registered for this webinar. And then you can come with your questions. There were questions in the Q&A section about if they have a question about the tools or there's a bug in the tool. So if bug in the tool, you can report to the Kaya admin or the Global Health Cluster admin. But if you have questions on how to use the tools, you can reach out to us. So we will have drop-in sessions in the future, so you can come with your questions. But I recommend you to spend the time now to go through it and go through it so you can understand the tools a little bit better. And then when you come for the drop-in sessions, we can answer your questions. And if there are like health clusters in the countries or an agency who wants to have more in-depth training or on any content, you can also reach out to us and we can see how do we support you with it. And next slide, please. And there was one question about who has access to the data. So the creators of Save the Children and Global Health Cluster, we do not want to keep your data. Our recommendation is, for example, the planning and decision-making tool can be used by the cluster, by the Ministry of Health. And that way, like every agency who is using it, feeding into it, the information can come to one central location. But the monitoring tool, you could use it yourself. That's why we have given access to the
master sheet.
Excel sheet, so you can contextualize it to fit for your own purpose.
Yeah. Can I
So
just quickly say, Miriam,
Yes.
if you would download this sheet and you upload it into your Kobo, then you are the owner. You can own it. So as an organization, you just can download the sheet and you upload it on your Kobo account that you want to have all the data coming through, and you can start using it. So that's how it works. Sorry. Just wanted to
Yes.
mention.
So the tools were developed for everybody, not for Save the Children, not for the Global Health Cluster. It was developed for everybody. So we want people to use it. And here you can say, like the development process, we engaged, we worked with so many people, we get the generous support from so many people. Here we don't have everybody's name, but we'll try to list the organizations who were part of the research, organizations who have participated in the pilot process, organizations or people who have been part of the technical advisory group from the day one up to now. And also when we translate all the tools to Arabic and French, we rely on colleagues who help us review check the content and make sure, what we're putting out for you is technically sound and accurately translated. So we want to thank everybody. I am sorry that the time was a bit short, but Dr. Iba already put the email address in the chat. So please feel free to reach out to us with any questions and comments. Dr. Iba.
Norian, sorry, there was
Yes.
a quick question. I hope it's a quick question for Willem around, is this interoperable with DHIS? That's come across a few times. So I just, Willem, it's Kobo with DHIS? I don't think so.
No, it's but yeah, I mean you can also create a dashboard, and you can if you it has Excel in the background, so there is a way for people with understanding of these different platforms to make it matchable themselves, but you will have to do your own work for that. It's not like automatically done, if that answers the question.
Brilliant.
Again, this tool is not to collect quantitative data, if that helps you with. So, I think the DHIS in general, we try to collect the service utilization data. And I know many agencies use this Kaya platform for quality monitoring, supportive supervision. That's why we chose Kaya as a platform for the decision-making tool and practical guidance. Just on the language, so the e-learning module currently is only available in English, but we have already translated into Arabic and the French. At the moment, we have colleagues taking the course in Arabic and French to see if that the language flows. So once they have provided feedback, once we have gone through the user testing stage, we will upload it in the Kaya platform. But most of the tools are available in Arabic and the French for the moment. And again, if your colleagues want to join the launching event in Arabic, French, and Spanish, please feel free to disseminate the information and encourage your colleagues to sign up. And Dr. Iba, over to you for one last comment.
Oh my gosh. Thank you, I think. Our job as the cluster, as I always say, I'm on repeat, is to help you. So all the feedback that you can give to us where you need more support or not. We've already had a request from Somalia for an in-country training. We would love to do that, resource dependent. But it is really around us collectively, especially as we all face so many challenges. So number one, thank you to you for all the work you do in general. Number two, thank you for committing to quality. Obviously, as health practitioners, that's what we want to do. We want to help people and help them get better. So my thanks is actually to you just for doing your work and being here today. And please let us know how we can help you. And we are really trying to give the support, tailored support that is required. Dr. Nasser, I'm listening to you, but other clusters as well and partners. Feel free to use the Health Cluster email to contact us with any questions or concerns or even ideas. We're all together here. So thank you so much.
Thanks everyone for joining. Hope you will use the tools. Bye.
Thank you.
Thank you. Bye.
Bye. Thanks, everyone.
Bye for now, everyone.
Thank you so much.
Thank
Thank
you.
you. Bye bye.
Thank you.
Thank you. Bye bye.